name is Sakshi Jagdale. Today's topic the blood pressure. Define of the blood pressure. Blood pressure is the force exerted in the blood pressure is the force exerted in the arteries by the blood against the wall of the blood vessels. And the significance of the blood pressure is the plays an important role to exchange of nutrient and the gases across the capillaries, and then to ensure the blood flow to the various organ of the body and required to form urine and required to form urine and required to form urine and required for the formation of the lymph. And the two types of blood pressure, systolic blood pressures and diastolic blood pressure. Systolic blood pressure is defined as the minimum minimum blood pressure in the arteries for the during a systole, and the normal systolic blood pressure is the normal systolic blood pressure range is less than the 120 mmHg, and this is mainly contributed by the force of the heart rate, normal blood volume, cardiac output, and the normal range is the 90 to 140 per Hg. And then second type is the diastolic blood pressure. Diastolic blood pressure is defined as the minimum pressure that is obtained at the end of the ventricular blood during the diastole. And the normal range of diastolic blood pressure is 60 to 90 mmHg, 60 to 90 mmHg. And then the pulse rate in the blood pressure, pulse rate is also calculated. Pulse rate denote the difference between the systolic blood pressure and the diastolic blood pressure. And the pulse rate it represents the force of the heart generate pulse rate it represents the force of the heart rate force of the heart rate generate each time to contract and the pulse pressure is the how to calculate pulse pressures. The pulse pressure is equal to systolic blood pressures minus diastolic blood pressure is equal to 40 mm per Hg is the normal pulse pressures. And then the factor affecting of the blood pressure is the age, size, gender, gender, climate, exercise, emotion, stress, diet, smoking, and chemicals. Um, uh, we see this one by one. First, age, uh, um, blood pressure, blood pressure varies throughout the age. And age increase, the the age increase, the blood pressure also increase. And then size is observed by the body size. The body size increase, the blood pressure also increase. A heavier and the taller for the child, then child higher blood pressure than the same age of the smaller child of the same age. Then the gender is the after puberty, the male have the higher blood pressure than the female. But in menopause, woman 10 times higher blood pressure than the same age of the man. And then gender then emotion or stress, anxiety, fear, pain, sympathetic nervous system get activated, causing vasoconstrictions, increasing heart contraction, and the ultimately rise blood pressures. Then diet is then diet then mm, diet is the mm, uh, people have the uh, rich diet. People taking a diet rich in salts and the rich in salts and unsaturated fatty acids, having higher blood pressures. And cocaine and coffee can also increase the blood pressures. Then smoking due to the nicotine blood pressures increases. And the exercise due to the nicotine blood pressure increases. And the exercise there is uh, and exercise uh, there is a um, and the exercise regular regular in the exercise regular exercise decrease the blood pressures and help to keeping blood pressure normal. And then prevention of the blood pressures, uh, the prevention of the eat healthy and well balanced diet, reduce salts and fat intake. And then exercise regularly, stop smoking, reduce weight, and reduce alcohol and caffeine consumptions. Thank you.